So when we have too high estrogen, not only does that create an increased risk for cancer, but it also gives all of these other symptoms like. Hi, I'm Stephanie, aka The Healthy Practitioner. This YouTube channel, we talk all things health, wellness, and detox. I've helped over hundreds of women get their lives back by regaining their hormonal health and getting them back in balance and feeling good. So today we're going to talk about what is the process that I take when I'm doing an assessment and looking at a new patient's labs. So the first and foremost, most important thing is their history and physical. So I have an in-depth patient review form that I have my patients fill out. It's over 150 questions by the time they get done with it, but it's asking what type of conditions that they have, what are their past experiences with any type of illness, medications, supplements. Most importantly, what is their goal? Because I can look at someone's labs and say, wow, this person needs to focus on A, B, and C, but their goal is X, Y, Z. I just want to sleep better. Well, okay, well, we'll adjust that going forward, or I want to lose weight is a common goal, but for myself, when I'm looking at labs, there's other things that need to be addressed, and then weight typically will just start coming off when we address the other symptoms. So it's always good to know what the patient's goal is. Next, learning about their health history from birth till beyond. Did their mom have a complex pregnancy and delivery with them that set them up for some issues in childhood? Did they have a lot of strep throat or ear infections? How was their cycle when the woman started menstruating? And what age did they start menstruating? All of that correlates with longer term symptoms as we become adults. And then we look at any traumas. Was there any childhood trauma, any abuse? All of that from children to adulthood affects hormones and general health going forward. And then I ask, what are exposures? Is the person exposed to chemicals all day, every day? Do they have air fresheners in their house? Are they exposed to mold? Have they been bit by a tick and have potential Lyme? All of those things we need to look at and address as well. And then I have the patients fill out what we call a Train 10. One of my friends and mentors, Dr. Nisha Winters, developed this beautiful Train 10 questionnaire, and it really is highlighting like the buckets of health. So we fill out different buckets like hormone health, blood sugar support, blood flow, inflammation, toxicity. There's all these different kind of categories, and there's questions underneath each category, and I have my patients fill that out. And whichever ones are highlighted at the top, that's the most important priority for that person. Typically, when I'm balancing hormones, the hormone balance bucket is always up high, but a lot of times blood sugar is up there, epigenetics, stress and biorhythms. So I'm looking at all of that when I take their labs into consideration. Then we get to the labs. So when I'm running a woman's hormone panel, I'm not just running a basic progesterone or estrogen. I'm looking at a specific day of their cycle. So if they are menstruating women, I'm looking at days 19 to 23 approximately when they're in luteal phase. That gives me the most accurate time of their hormones in their blood when I'm testing. I look at their CBC to look at their white blood cells, their red blood cells. Are they anemic? Are they looking like they have some sort of chronic infections? Is their blood thick and sticky? I can tell a lot just by getting a CBC. I also look at an iron panel. How is their iron? How is their ferritin, which is their iron storage in their body? They tell me that they're fatigued. Well, I want to make sure that they have enough in their reserve when they're bleeding that they're not low in iron. I like to look at inflammatory markers. CRP tells me acute inflammation in the body. Fibrinogen tells me inflammation in their blood. Do they have thick and sticky blood? I look at homocysteine and other blood markers that show inflammation. I look at a CMP, complete metabolic panel, that shows me liver, kidney function with electrolyte function. I look at vitamin D status, and I look at a full thyroid panel, which for me is TSH, free T3, free T4, reverse T3, shows me a lot of potential autoimmune issues or inflammation. And then the antibodies, TPO and thyroglobulin antibodies. If either of those are high, then I get concerned about, and high for my standard. Western medicine has a big range, but really if it's any elevation, then I'm getting concerned with this person could be getting Hashimoto's type symptoms. It could turn autoimmune, so we want to nip it in the bud right when it starts happening. So we look at the thyroid, we look at cortisol levels before we get our labs drawn before 10 a.m. so that we can just kind of get a spot check of adrenal function. Typically for me, doing that gives me a good overall picture of what they have going on. Again, I'm looking at their questionnaire and I'm comparing. Is their adrenals, their blood work looking like they're really struggling and they're saying that they're very fatigued? Well, there's probably an adrenal imbalance. What I've learned doing this over 10 years is that typically it's not just sex hormones. There's the thyroid, there's the adrenals. It all works together. And if one of them is off, the others are compensating for them and can make that person feel different type of symptoms. So we look at that, and then we look at the sex hormones. We're looking at the estradiol, progesterone, testosterone, and DHEA sulfate. So when I look at those, I'm seeing the DHEA, it's like a motherboard hormone. Not only does this help sex hormones function, it also helps adrenals. So is that adequate for the person's body? I look at testosterone to make sure that it's not too elevated. I like to see my patients in between mid-teens to mid-20s. It seems like the sweet spot. If they're too high and then I see their progesterone low, I support them with that. And then again, I'm looking at progesterone and estrogen. Not only am I looking at them during the luteal phase, but then I'm taking them and putting them in a calculator, looking at the progesterone and estrogen ratio to make sure that one is not overbalanced than the other. Typically in the Western states and Western medicine, what I'm seeing mostly with 90% plus of my patients is progesterone deficiency and estrogen dominance. So when we have too high estrogen, not only does that create an increased risk for cancer, but it also gives all of these other symptoms like fibrocystic breasts, fatigue, moody, irritability, because progesterone is our nice calming hormone. And when we don't have enough of that in our body, then we start feeling all of these symptoms. So after looking at all of those labs and looking at the patient's questionnaire, I start putting together a protocol for them. And typically it ends up being maybe 5 supplements that they start on that can help get them back into homeostasis. Sometimes I recommend injections. If their vitamin D is really low, I like to see it between 60 and 80 on the lab test. That's mg per deciliter. But if I don't see it between 60 and 80, I'm wanting to support that and get that up for immune protection. A lot of times, ions in general, we're at around 28, which is even low for the Western medicine standards. So most of us are vitamin D deficient. We're not getting enough for our immune function, so I like to boost that. If a person's high in inflammation, I do a fish oil vitamin A combo and just do that for a burst just to kind of help calm down the system. And then hormone balancing. Do they need progesterone cream? Do they need oral capsules? Do they need myoinositol for their balancing? So again, it's all of these tools that we have available, and it's individualized for the woman's unique cares. I see so much benefit from them doing this. It's simple testing, but a lot of times the providers aren't familiar with it. So I'm trying to get more providers on board with doing some, luteal phase hormone testing and looking at the bigger picture, because if we do this, we have a lot more happier, healthier women walking around this earth. And we know that that equates to better home lives, better children, better functioning for the whole family unit. So thanks for coming along with me on this journey. I hope that you get your hormones tested by someone that is certified or that understands how to read it in a functional way and get you feeling the best that you can. Until next time, have a good day.